I'll start with some of the updated of our latest numbers. As of yesterday, there have been 7,738 cases of COVID-19 in the Commonwealth of Massachusetts. As of today, we have 1,233 cases in the city of Boston. That's up 176 from yesterday. We've had 106 people in Boston make full recoveries. Unfortunately, now we're up to 10 Boston residents who have passed away out of 122 in the Commonwealth. That number is the hardest one to see rising. It represents neighbors that we lost, families grieving under very difficult circumstances. Our thoughts and prayers are with all of you and your families. I want to also say a word about our veterans who passed away in Holyoke at the Soldiers Home and in Chelsea who passed away this week. These losses are devastating. My heart goes out to those families and communities as well. I think of what those veterans gave to our country and what all veterans have given to us, how much we owe them, especially now. We have reached out to our veteran service providers and residential homes here in Boston to help them mitigate any risk and address any concerns that they might have. And I want any veteran or family member of a veteran to know that if you need support or you need anything, please reach out to our Office of Veteran Services in the city of Boston. You can do that by simply calling 311 or reaching out on email at veterans@boston.gov. That's veterans@boston.gov. They are working remotely, and we're here for you. On Monday, we announced a Pen Pal program for veterans who may be feeling lonely or isolated. Right now, we have seen an outpouring of interest. 450 people have reached out. We have so many volunteers that we're going to be able to not just fill that program, but add volunteers to our food deliveries and other programs for veterans. It's a testament to Boston's respect and gratitude for those who served our country. I know that many people are concerned also about the capacity of our healthcare system. I'm in close contact with our hospitals about what they're seeing and what their needs are, and about how we can advocate and support them. The governor yesterday was at the DCU Center in Worcester. He mentioned that the Boston Convention and Exhibition Center in South Boston has been designated as a field hospital. I can report that we have plan going on right now into effect at the Convention Center. Construction starts today for 500 beds for homeless adults, both men and women, who have tested positive and need care but do not require full hospitalization. We have a request for proposal out right now for a partner organization to operate that section of the Convention Center. Those 500 beds will bring our total number that we have to over 1,000 beds to care for our homeless population. That includes 250 beds at Boston Medical Center's Newton Pavilion that we're working with the state on. This space, allows us to care for a population with complex needs. And if necessary, we'll be able to open up the Convention Center beds for hospitals to serve a subacute COVID patients from the general population. Our work has also opened up space for additional capacity by implementing state and medical partners at the Convention Center. So we're working collectively together on how do we activate this space if it's needed. Moving forward, we'll continue to be an active partner to our medical community in securing the space and support as they need it to do their life-saving work.